let's just take a moment of silence to consider the matters at hand tonight.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Katie, can we have a roll call, please?
Councilman Wallace.
Here.
Councilwoman Rasmussen.
Here.
Councilwoman Insero.
Here.
Councilman Grayzel.
Here.
Councilman Camerano.
Here.
Council President Muldoon.
Here.
I'll entertain a motion for opening the
I
agenda
move
session.
we open the agenda session.
Is there a second?
Second.
All in favor?
Aye.
Are any items for the agenda session?
No, I'm good, thanks.
No, it's really an agenda session item, but I did have a question. You tell me if it's appropriate or not. The house on Center Street that burned down, how many years ago? I think it's about a year or two ago, we were told it was coming down. It's still there. It's a safety hazard. I would hate to think what would happen if it ever went up in a fire or something, or if somebody got trapped inside and we didn't know it. Any idea what's going on with it?
Yes, they pulled the demolition permits on the building.
When?
They've done, when did they pull them?
Yeah.
I don't know exactly, it was maybe a
Because
month
I think you told us that a year ago, Bill.
No, well, I don't know, not that they pulled the permits, but they've done the asbestos removal. Chris is on them to move along and actually is writing another summons to them, or has.
I don't know when that fire occurred. I want to say it was 3 or 4 years ago. Councilman, you may know. Five.
I think it was 5 years.
So that house has been sitting for 5 years. It's time for it to come down. If the property owners don't want to take it down, I propose we go ahead and do it, and then charge them the cost or whatever the law permits us to charge them back. There is a provision in state statute that allows us to do it. I think 5 years is a ridiculous amount of time to give somebody to take down a house that's not habitable. So if we can deal with that, I'd be really happy. If they don't want to deal with it, we should do it.
I agree with you. I think, though, that it's been in foreclosure and new ownership.
I don't care. I think the state statute gives us the ability to do it. It's been 5 years, and it's an abandoned, burned-out house. And, you know, how do we know nobody's living in there?
Bill, is there,
The lock is broken off the back door that you can see when you pull in the diner parking lot.
I guess, you know, I noticed.
probably maybe decide on a date, and if it doesn't happen by then, I mean, I can see your point about 5 years is,
Well, if the lock's broken off, it's a pretty good indication people are going in. I don't know if they're going into scavenge, you know, for copper or anything else, but 5 years is a long time for us to be letting that sit there. I've heard the bankruptcy issue, I've heard the sales, I've heard it all. I think it's time for us to say enough.
Maybe our council can research and find out what kind of notice provisions we have to comply with, and then we can move ahead.
I was going to suggest we have our zoning officer give us a report as to the status at our next meeting.
But then we're waiting 2 weeks. I mean, 2 weeks we can, you know, maybe find out what's going on and act on it rather than give us a status report. I mean, you could probably call them and get that on the phone. But the point is, it doesn't seem like we're moving very fast. And I don't want to spend our money, but I believe the provision in the statute allows us to recoup the funds and charge back the cost.
Well, if the demolition permit has been secured, you have to assume that they're going to demolish it, but I'd like to know when.
yeah, the
Yeah, I
question
think
is
we
when.
assumed that about a year ago, and it
I
hasn't
don't
happened.
think a permit for demolition was secured. I
No,
think
we
it was,
talked about it at that point. You know, we talked about it, and, you know, I don't know how long you can hold on to a permit for demolition, but, you know, when you drive by there and you see it, and
Oh,
you think about the potential,
I agree
Yeah.
with you. It's
and it's been 5 years, I thought it was 3 or 4, but we really need to do something.
Well, why don't we do both? Check with the zoning officer, and maybe the attorney can still look into it,
okay.
so by the time.
That's fine.
Just for clarification for me, Bill, you said it was pulled. Does that mean they had taken one and then they pulled it back out? They're not going to do it? What's
Oh, no,
pulled?
they-
What does pulled mean?
They've taken out the permit.
Oh, they're taking out the
Yes.
permit?
They've already started the asbestos abatement, and that's done as far as I know. They have to, of course, have the power company sign off. They have to disconnect the sewer and other things before they can start the actual
They're
demolition.
using the driveway for parking, too.
For what?
Probably employees of the diner, I don't know, that they're using the driveway for parking.
Well, certainly something we should look
Well, I believe that the owner from the diner is the one who purchased it.
That's correct, yes.
I just,
Alright, so that's
yeah,
what we'll
no,
do.
I mean,
We'll
as
do
long as
both.
we have a plan, because I'm really tired of looking at it.
Okay. Are there any other items?
I have an item. 6 months ago, this council passed a complete streets policy, and at the end of the resolution, it reads that within 6 months of adoption of the complete streets policy, the borough administrator, borough planner, borough engineer, zoning officer, a representative of the police department, and DPW director shall report to the borough council regarding steps taken to implement this resolution, plans for continued implementation in the coming year, revisions implemented and/or needed to codes, ordinances, rules, plans, and procedures, and any desired actions that would need to be taken by the borough council or other borough departments. So since it's been 6 months, do we have any plans to do that? Because I haven't heard anything.
I don't know if there's been a formal meeting, but I know that there are plans and things that have been done. For example, there's been applications for a grant for sidewalks on, is that New Durham?
New Durham from Michael to the
New Durham
Greenway.
from Michael down. There's been applications for the resurfacing of Bridge Street. There have been a number of flag crossings put in. There's been meetings with the county to paint crosswalks. There's been a meeting with the safety freeholder poles.
Yeah,
I don't know what it's
Freeholder
exact.
poles. Public safety, I
Public
think he
safety.
has as one of his areas.
To create a program and train our officers for pedestrian safety in the Route 27 corridor. I'm just trying to think of some of the other things that we've done. We've, in our budget that we're going to introduce tonight, we have a proposal for replacing two of the non-working lit crosswalks and adding 2 more. You want to help me out with them?
No, I mean, yeah, I think, and people should realize a lot has been done and a lot is planned, but I think Councilwoman Sarah's point is
How
the
will things
policy.
physically look different, and how will things be reported to us?
Yeah, well, I think that in the resolution that established the policy, it asked for that. It's basically a report, so I think I would look to Bill to lead that, because I think we need to document. I mean, we've been
Okay.
reporting lots and lots of developments and initiatives, but I think it makes sense to have a report.
Just have a formalized list of what has been done.
Yeah, I think that's kind of what,
Okay. So,
and I would look, I think, Bill, I think that it should come from you coordinating with the other department heads, not a council person, so, I mean, I think it says, right? Borough administrator.
Well, I think it puts them all on the same level: borough administrator, borough planner, borough engineer, zoning officer, representative
Right.
of the police department, and the DPW director.
So I think Bill would be the
so if you have
coordinate that.
the
Yeah,
meeting
yeah,
and give
or
us the lists of
administrative
of the things that are planned and the things that are being planned, I think that's.
I mean, even, we had a meeting this morning with you and Bill and the police chief and captain, and we know some of the things are being done, but I think to comply
Right.
with this and to make
Okay.
it public, to have a report would make sense, right?
And I think things are certainly happening, and things are certainly taking place, but I think it would be helpful for the public to know how our new projects will comport with the new complete streets policy. So if we're repaving streets, will they adjust to a new complete streets framework? And if they won't, why not? I think those are some of the things that people want to know,
Okay.
you know.
Well, I think that it depends on what the council does in the way of monies that
True.
they approve, and also what the cost of the repaving would be, and also if we get the grant from the state for Bridge Street has a big factor in, because when we've gotten other grants, we've been able to do certain side street areas with the grant if it's attached to that street. For example,
Oh, okay.
with Bridge Street, we might be able to do a portion of Middlesex Avenue. And I know Councilman Camerano and I have talked that that's Middlesex Avenue by the Hampton Park is an area that really is one that should be moved with, you know, with sidewalks and things to make it a complete street. All right?
Your Honor, even on Bridge Street, though, I mean, my fear, we just do resurfacing and we make it a faster road. Do we have anything in mind to make it pedestrian-friendly so people who live across Bridge Street from the park, who may want to walk to the park, or maybe walking to the train station, because there are a number of people, have a safer way to cross the roads and then work their way down to the train station? I think that's kind of where you're talking about.
Exactly.
It's not just about paving the road, it's about trying to find a way that the road is paved, but also where pedestrians have, and bicycles have greater access and greater ability to safely use them.
The-
So I think,
Well, I think that would have to come with the engineering estimate,
of course.
and not knowing if we're going to, hopefully we're going to get the grant, but not knowing if we have the grant.
But I guess the policy, the question is, knowing that that's out there, and potentially, do we have the grant? Do we have a plan, once we get it, to determine whether or not we can afford to do any of that stuff? And I think that's the concept that Councilwoman's trying to get at.
I think when we checked with the borough engineer, I think
He's well aware
Yeah,
and helped in the
and looks to-
participating of the writing the
Because
policy.
that's a tough street to cross,
yeah,
even at the light.
so, okay. I agree.
Okay. Anything else on the agenda session?
Nope.
Can we have a motion to close then?
Move we close the agenda session?
Is there a second?
Second.
All in favor?
Aye.
Aye.
Okay. We now have a discussion about our insurance renewal. Mr. Atkinson, could you come up front and just give us I guess, a little summary, synopsis of, why don't you sit up front, up here? I think you feel more comfortable.
Sure.
All right. Good evening. I don't know what Bill passed out, but I assume it's just a summary of the year-end to the renewal option. Is that what you passed out, Bill?
Well, I went into a little more detail than that concerning the process that begins fairly early in the year, but not so early as to not have sufficient data with which to request proposals from other brokers, which I did again this year. Contacted 5 brokers or TPAs to solicit quotes, and as a result, was unable to procure any. There was one other company, I guess you could call it, with the Central Jersey Health Insurance Fund, who did request information, which was provided, but determined that they could not be competitive and declined to bid. However, concurrently, Mr. Atkinson, through IDA, contacts other reinsurers to solicit quotes on the reinsurance portion of the plan, and he can explain that to you. He did contact 11 firms. They, for their proposals or their declining to submit, are included in your packet, and as a result, the best quote was from our current reinsurer, U.S. Fire Insurance Company. We intend to keep the same QualCare network and also the same aggregating specific and corridor. And I think that I'll let Mike go from there.
Bill,
Yeah,
can I ask you a question before, sorry?
Yeah,
just
sure.
to, on the process a little bit. So the, so the borough is self-insured, and then we do the reinsurance thing for the things that Mr. Atkinson's going to talk about, right?
Right. I mean, there I think, has 3 basic components. We have the reinsurance component, which seeks to limit any catastrophic loss that we would have either in a specific instance of an individual or in the aggregate, which would be a number of individuals.
Right.
And that's actually the smaller part of the insurance. What we're responsible for also are the claims. And I think generally over the years we've done a good job of estimating the claims. Sometimes we do better, sometimes we don't. But that's why we have the reinsurance to keep everything under control. We limit the total amount of a claim per individual to $60,000. And in addition, to save some of the premium over the years, we've added what's known as a corridor, and the corridor is just an extra benchmark that we have to meet in order for the specific to kick in. In this case, it's $95,000, which is the same as last year.
Right.
Which is actually good because we don't want to get that so high that we're going to price ourselves potentially out of some of the markets. The nice thing about this proposal is that it came in as the best proposal out of the ones that Mike was able to get quotes for. And it is, of course, with the same company, which will help us in the future. And if they are going to be quoting again, potentially they will take a look at us and say, hey, you know, let's take a good hard look at them and come in with a good thing because they've kept us for 2 years.
Okay.
Over the past, I think it's 4 or 5 years, we've bounced around with reinsurers, which has made them, some of them potentially reluctant to bid on us, thinking, well, you know, we're just gonna go.
Yeah, that's correct.
And they potentially have risk. It's not risk-free for them. The first year that we went out to self-insurance, the reinsurer took a big hit.
Yeah.
And we came out very well.
Extremely lucky.
But there is that potential for them, so they have to through their actuaries do that risk analysis as well.
Okay. So the question I had was really not about the reinsurance part, which we're going to get into, but when you, in your introductory comments about you looked into or contacted other either agents or brokers, whatever the right terms are, is that to get determination of comparing the claims part, comparing something to the self-insured approach, or?
Well, I mean, Mike can address that. I don't believe that, I mean, I go out and I ask for any kind of a plan that anybody has out there, but I don't think you're going to find anything that with a straight indemnification plan that's going to be able to match the rates that you have with the self-insured plan. And that's why we went to the self-insured plan, because we've actually done well, and you know what your claims are going to be. So that you can project, and a reinsurer can project, and you have much tighter control on what's going on with your plan, and then you can also look toward the future of redesigning your plan, you know, as possible through collective bargaining and other things. So it provides you much more information, and it also provides your reinsurers with more information, with which to potentially give you a better deal.
Okay.
Bill, can you, before we go to our speaker, can you just very briefly summarize the changes that have occurred in terms of the requirements for employees to contribute to healthcare plans, and how that's affected our cost structure?
Well, there actually have been a good number of changes to the plan. When I came here, the plan was considerably richer. The deductibles and coinsurance were almost non-existent. Co-pays were non-existent. It was an indemnity plan where the employees could go to any doctor and be essentially covered for just about everything. Over the years, through collective bargaining and other measures, we've increased the deductibles, the coinsurance. We've added prescription plan and are in the process currently of changing that, and looking for cost savings where we can.
Are employees required to contribute a greater amount toward the cost of
Yes.
coverage than they have?
Yes.
Can you go over that?
Sure. Back in 2010, a public law was passed, Chapter 2, which required employees to pay 1.5% of their salary, their base salary, as a contribution towards their health care. Then in 2011, another public law, Chapter 78, was passed, which, among other things, made considerable pension adjustments as well. Required employees over a 4-year period to increase their contributions to the health care plan, and that's a direct payroll deduction, which then is used and can only be used as an offset for the borough's health insurance charges. Due to collective bargaining, some people were held back and did not get on the 4-step plan until just this last year, but all of the employees are required to go through the plan. The Chapter 78 requires a percentage based upon an employee's salary of the health benefits cost. So when the health benefits costs rise, the employee is going to be paying a higher amount of and percentage of health care. The lower paid employees pay less of a percentage. The higher paid employees July 1st are going to go up to 35% of the health benefit cost. And that's a COBRA rate, which is adjusted actuarially, but so there's a significant contribution.
Thank you.
You're welcome.
Your Honor, if I may.
Yes.
Just a couple more procedural questions. And, you know, I should just get last year's meeting and play it over again, because here we go again. Bill, how do we go out for quotes? Every year we go out, you solicit quotes, we don't get any except one. What are we doing wrong here? Number one, you know, to me, the health insurance market's a fairly competitive market right now, and I'm wondering if we're limiting the scope of what we're looking for to be too much, which kind of leads to the next question. How do we know the self-insurance plan is still the way to go? If we don't have any idea as to what the other types of plans cost, because we didn't get any quotes on them. And then finally, the question is, if we started this process really early in the year or fairly early in the year, why are we getting this before the last meeting, before the policy expires, where we in essence have to approve this tonight or the employees won't have benefits? So you can answer them in any way you want. But the biggest concern I have is, how do we go about getting quotes? Do we send out written RFPs? Do we send out letters to carriers? How do we go about it?
We've done it a number of ways.
No,
We've
but
sent
how
it-
did we do it this year?
This year, I contacted the companies that I know have been interested in the past.
Did we contact them in writing?
Yes, I did,
Okay.
by email, and
By
also contacted some that I had heard about.
Do we
The
put it
problem,
on,
let me just.
do we put it on our website that we're accepting?
Well, I have not.
proposals?
The problem that we had in the beginning was that we ended up with all kinds of companies who claimed to be competent and qualified and spent an awful lot of time trying to ascertain whether they were, and oftentimes found that they were not.
Well-
It's a specialized type of market that not everybody can provide insurance.
Everything we do in this world is specialized. I wouldn't hire a plumber, somebody to put a deck on my house, somebody to do almost anything for me. I wouldn't buy an appliance, a power tool, without shopping around to more than one place. And I'm concerned that year after year after year, we have the same problem. We get one bid, and it's no disrespect, but something is wrong with what we're doing. maybe we need to put out something more formal. Maybe it should be advertised. Maybe it should be put on the website. And I think I said the exact same thing last year, but it didn't happen. The other thing is, how do we know the self-insurance is still the way to go? We've been in it, how many years, 7, 8?
We've been in it
Almost,
15.
yeah, at least
Okay, so maybe
11 with us, I
maybe
think.
15 years ago, it was the way to go, but we don't have anything to measure it against, because we don't get any other comparable quotes. And I'm actually very concerned that we really are operating in the dark here.
Well, we have a quote,
I'm going to let Mr. Atkinson
well,
answer that
but we
question.
do have a quote
The
in our-
other thing,
in our packet
we
from
don't
the-
have a quote from the
from the
state.
state health benefits.
This is a rate sheet that's effective September 1st of this year, not now.
Right, because you need lead time to get into the state health benefits plan.
Okay,
You
so
just
we,
can't-
but we knew this last year because I asked for it. But is this an actual quote from the state health benefits
Yeah,
plan?
the rates are
Or-
published. I tried to match the benefit as close as.
But we didn't request an actual quote from them.
No, you don't need to. You could just go out and publish it. You can go out formally, get a full quote, but no. We
But wouldn't
just
they-
base the rates off what the rate sheet, they file the rates, they're public, not, So we went out and just matched up the census with the closest plan,
say
saw
the
what the
same-
cost is. and
Say
it-
the same thing I said to you last year. It's not in your interest for us to go into the state health benefits program.
You could,
it's
it's
not.
not the best for
So-
you anyway, because you're going to pay more money, too. They don't match your plan design.
We don't know that.
Yeah, we do.
I guess we have this that you got from the rate sheets, correct?
The rate sheet's off the state website.
What's the formal
Correct.
process for applying for a quote from the state health benefits program?
Be honest, I really have never done a formal request because that's not really my
I
business
understand that.
model.
I understand that.
So I
you
don't really
can-
work in that
And I
domain.
get that. You do what you do, and that's fine.
Right.
But my point is, if we don't, as a borough, request that, we have no idea if this is, and it's no disrespect, but if this is even, these are rates for really September 1st on. We're talking about May 1st, so we're 4 months off.
Because you can only get into the state at certain times during the year. I believe there's certain lead time and times where you can enroll in the state program. They don't
But-
have open enrollment, if you will, every month.
Yeah, I'm not sure how it works. Bill, have we
So-
tried that? Have we formally requested a
Not directly, no, we've relied on
So
Mr.
again,
Atkinson.
we don't really have a comparison here
You mean between self-insurance and,
between this
is this,
self-insurance plan and anything. We don't know if we're getting the best deal.
Well, I think you have to remember as well that the Blue Crosses, Oxford's, United Healthcare, fully insured entities of the world, they don't have your plan design in their system.
I
So you guys
understand.
have like 8 or 9 separate plans within the 109 people enrolled in the plan.
But maybe that's an issue we need to explore here as to narrowing the scope of the plans, however we need to do that.
Well-
But my point is, we're operating in the dark here, and I'm really concerned. I said it last year, I'll say it again. We just need to figure out why we're not getting any quotes. Because this is a competitive market.
Well, I can't speak for the brokers that Bill went to, but I think part of their problem is the issue with that our quote is very bare bones. There's no commission in the quote, so that really eliminates a lot of broker incentive because,
It may be the
and
case.
fully insured will not be able to match your plan. So maybe that turns people off, and I really don't know the reasons why Bollinger or, the South Jersey HIF and some of the other places Bill went to didn't quote. I can't speak for them.
There's got to be a reason, because they quote everywhere else.
In Qualcare, we give them, I know Bill gives them an opportunity to quote every year, and they didn't even respond to his request this year.
I have a question, Mr. Barth.
Yeah.
Just to follow up on something he said. He said we have 8 or 9 plans for our 106 employees. And that's because of our different collective bargaining units.
That's correct, yes.
So it's not that one employee can choose between 8 or 9 plans. It depends on
No.
where
Oh,
they're
no,
working
no.
within the
Depends
borough.
on,
I
it
just want to
depends on
clarify that.
if they're Teamsters,
Right.
DPW, if they're ASME, if they're, which group they're associated with.
I just want to clarify that for the people who are watching at home.
Can we start to work towards standardizing
We've been
those
doing
plans?
that for 23 years.
Well, that was my next question. So if that's the hindrance to all of this, what is the process to lining everyone up, because to have basically an employer of 106 people and 8 or 9 plans is
Well,
ludicrous.
don't forget, a large number of those are retirees.
Right.
Okay?
But they're,
And I'll reiterate it, we've been doing it for 23 years, but you're not going to get people to agree to necessarily everything, particularly in a climate where you're only giving them 2% increases and then requiring them to pay 35% of their plans. Sometimes we can, and we have been doing it, and we'll continue to do it when we can, but it's not a process that can be done for all groups all at once. The other thing that hasn't been stated is we've also got an issue being self-insured with run-on claims. And you're asking an insurer to come in and give us a quote, that's fine, but we still have to somehow deal with, what is it, $457,000 of potential run-on claims.
Run-out claims, yes.
Okay.
Claims
And
that
that's
are
one of the
unreported.
What's the run-on
That are
claim?
ongoing, that if you
Carryover.
switch-
Right, they would,
For example, if we were to end reinsurance today, or May 1st, the claims that are submitted to us, and you had a new company come in, the claims that are submitted to us from the time before by any employee is a run-on claim. So
And we're still
Or it could
responsible
be
to pay them.
an
Right.
ongoing.
The new company is not, and that's another, that's another detriment.
Well, I mean, but in the industry, there's ways that they cover that so-called run-on or tail, or whatever you want to call it. That's pretty standard throughout the industry. It comes with a price.
but in a self-insured world, that would be correct. In a fully insured, the fully insured carrier is not going to pick up the run-out expenses of our self-funded plan.
Okay.
They won't pick, they'll start fresh on, June 1, May 1, and then everything moving forward, they
Well,
would cover for the 12-month period.
Using that
and then they
logic,
have
he
their
has
own
us
run-out.
captive forever, because we're always going to have those
Well,
kind of
you're always going
claims.
to have that, or you're going to have to deal with it somehow. That's-
So, I mean, there are ways to deal with that, and we have to make that decision, but,
Sure.
I mean, it's pretty standard in the industry when people switch.
I don't know that you can get private carriers not only to bid on a myriad of different plans, 10, but I don't know that you're going to get them to bid on plans where you retain complete choice either.
You could be right.
I mean, that's a sea change that we have to explore strategically, and there's been a sea change there in that now employees are contributing to the cost of their plans. So for the first time, there's an economic incentive, or at least theoretically, there's an economic incentive for them to look at the idea of going to a network, out-of-network situation that's binding.
Right.
I mean, that's easier said than done.
I would like to point out that your fixed cost, including your premiums, your access fees and all of that, are up a total under this proposal of $2,022.60, which is a 0.55% increase.
What page are you on, Bill?
I'm on 8, but you won't find that. That's a calculation you have to make.
Okay.
And in
But
this
that's on
kind
the
of...
reinsurance part, right, Bill?
What's that?
That's on the reinsurance
That's,
part?
That's on
yeah,
all
on all your
fixed.
fixed costs.
All
That's
fixed.
his fees, the
Yes.
access fees, which haven't gone up for 10 years. I mean, that's unheard of, I think, in this kind of a market that you're paying. Now, your claims are your claims, and they're going to be your claims.
Like,
And we don't know if we're going to have anybody hitting our specifics. This last go-around, we did very well.
Yeah, this year was much better than the year
And-
prior.
and which-
The year
which
prior, we had
helped us in- which helped us
$900,000
in our,
in claims overspent.
which helped us in our experience, and of course,
Right.
the price that we were quoted. It's possible through the Affordable Care Act prevention portion of that law that has come into effect and has to be incorporated into our plan, that we will have more savings as things go along too. So, and the whole thing is evolving.
I have a couple of questions. Is Metuchen unique in the fact that we have so many different plans? Because other municipalities have unions and bargaining, collective bargaining. So how are we so different you know, in what we need to satisfy all these different agreements.
Well, most of your plans have retired police. And the result, and the reason that there are different plans is a result of collective bargaining, which changed the deductibles and the
Right, and
co-insurance and
that's-
all of that.
It's not uncommon.
So, I mean,
So
if you didn't, if you weren't doing that, then you'd have, what, maybe 3 plans or 4 plans? The reason you, the more you try to control your costs through changing plans through collective bargaining, the more plans you're going to have.
So in other words, whatever plan or whatever agreement they were under when they retired, that's their agreement. And if there's another agreement when some other people retire, that's their agreement. And that's why we have so many different things.
That's currently, yes.
Okay.
We should be able to change that, no? Retiree plans?
You're allowed to adjust.
We're allowed to adjust those, aren't we? There's
Well,
no collective bargaining when somebody retires.
That's, we need to talk about that in closed session if we're going to talk about that. Yes, the answer is yes and no, and
It's a
I'm
generic policy
investigating it.
question,
Yeah.
as far as we can or can't. It's not a
No, it's a
specific,
le-
are we going
it's-
to?
It's a legal question.
And then my other question is, in just reading through all the numbers, which basically it seemed like it's a numbers report, what's going on with wellness? Is there any kind of wellness plan for the employees incorporated into this?
Yeah, there's a, they have 100% benefit for their preventative wellness within the framework of their plan currently, so there's no cost share for the members. So yes, there is a wellness component there. The members are free to go to and encouraged to have their preventative medicine and their wellness obviously taken care of. I mean, it benefits everybody if, you know, if they do that. It benefits the town, keeps their claims lower. If they catch something early, it's always a benefit to the plan to manage that situation that may come up in that visit. But there is, there is definitely a wellness component to the program.
So this is different than last year. Like last year, was there any wellness?
Oh, absolutely. There's always been a preventative benefit, just with the certain changes with the ACH, the healthcare law, got rid of the cost-sharing component of that, since I believe you're no longer grandfathered.
And
So, Mike, in essence, if somebody was going for a flu shot last year or the year before, they would have to pay.
They would have probably had to pay the copay or whatever,
Right.
deductible or something along those lines, but today that goes away and everything's at 100%. There is no cost sharing.
Or
for
if they're
that.
going for a preventative checkup.
Right.
In the
And
past,
anything that's
in the past, there was-
doesn't have a diagnosis associated.
In the
with
past,
it.
there was a deductible, and now it's covered because of the
changes.
the change in the law.
Correct.
I'd also like to point out that we've instituted a diabetes screening program.
Oh, yeah.
That was brand new, that we put in
The active
recently,
care.
the last.
Right, that's
yeah,
exactly right, the
for-
active care program.
For those people who were identified as either being at risk or who currently have diabetes, and that's another program that is no cost to the borough.
No, it's a voluntary program
We
to
don't
the
pay
employees.
him anything
We-
to do
we-
it, and the advantage is that it provides for almost full-time if the monitoring of a person's health or near close to that, so it can identify issues that they have and hopefully prevent some more serious occurrences that would come
Right,
as
no,
a-
that's correct.
as a result of that.
Is QualCare the provider of that, or administrator? or-
No, we introduced that program, IDA. Introduced that program through a vendor of ours.
Oh, so you're
A
the vendor who
relationship that
works
we
with the
had, that
pay-
we brought to our client base.
Okay.
all right, so my question is are we tracking this? Because where I'm employed, we get tested for like cholesterol, sugar, HbA1c, and blood pressure and weight, and then they calculate our BMI and everything.
Sure.
All of that is kept, you know, they keep that in a database.
Correct.
And then you have the next year, you have to make certain improvements. They don't expect people that could never, ever, you know, people who are diabetic, their sugars will never be normal, their HbA1c will never be normal, but they have certain benchmarks that they should meet. And I was just wondering, do we have anything like that, or is that something we can incorporate for next
We
year?
could definitely incorporate it. We do have programs that will do the biometric screenings and
Correct, yes.
come in-house here, do the testing. I mean, it's just a matter of setting that up. But yes, we do that, and we could introduce that to the borough.
Okay, 'cause that's something I would be interested in seeing, because I think it really helps people keep track of how they're doing. You know what I mean?
Is there an added cost for that, or is that just...
Yes, there is a cost. I could get you I'll get Bill the pricing on that. Depends, I mean, obviously, we would probably go after the retiree population. It would just be mostly the active population.
Okay.
Because of the logistics of that. But we can definitely introduce that.
Okay. Any other questions?
Yeah, Mike, in years past, one of the positives on the plan is it's always gotten pretty high reviews from employees for simplicity. This year, I seem to be getting some anecdotal questions about problems they've had with claims payments and stuff like that. Is that the case, or have there been issues, and if so, do we know why?
There's really always going to be an issue. I mean, there's always claim issues. I mean, it's a very complex process. It's not an easy process. You rely on a lot of doctor-patient integration at times. I haven't had many complaints. I think I had one complaint from a policeman this year on a claim situation that we were able to rectify and take care of. But, you know, to be honest, it's a pretty quiet group, and I don't get a lot of complaints. But the process is never going to be clean. You know, it always is very difficult to process. You know, one person gets a balance bill and it crosses in the mail to your check, and everybody can get aggressive. But I have not heard any major complaints, other than maybe one or two instances that I've talked to Bill over the course of the year with. And
We've had a few, and usually the problem is that the people talk amongst themselves but don't bring the problem to us. So it gets to the point where it sort of festers. And
You know, in fairness, Bill, I mean, I've never heard complaints in the past, so that's why I asked the question, was there an issue? It sounds like you've been on it and resolved it. I don't think it's people talking about it. I think it's people who legitimately had some concerns.
Yeah.
Not major, but enough to annoy them.
No, of course, and any time you have a situation that lingers. I know one of my colleagues was involved in, I believe, that claim that Bill and I got involved in, and it did get rectified. And that was the only one.
How long does it normally take for a claim to be processed for one of our employees and then before they're covered?
Last year, well, through March 31st, we processed 1,800 claims in 17 days was the average turnaround time.
Okay. So 1,800 claims, 17 days,
Yes, on the average.
on the average.
And that's in the renewal packet that Bill has. There's a turnaround time report there.
Okay. Now, if they go to the stay-in network, is it a quicker time?
Not necessarily. I mean, it all is real-time. We do a lot of electronic transfers, so the data gets to us fairly quickly, and then it's all dependent on the funding of the claims through the borough, because we report what we've processed, and then the borough funds the claims, which have been very timely. So I think that's why you see, because every 2 weeks we do process. I think I run a 2-week check cycle, so that kind of makes the 17-day mark. So we're pretty
well
timely.
within the state guideline, the state law of
Oh, yeah.
30 days or whatever I forget what it is.
Yeah, well, you know, we definitely follow that, you know, especially with the discounts as well, because you don't want to lose the discount over time, too, because there's time, you know, that's all time sensitive as well.
Could you explain the discounts a little bit?
Yeah, QualCare saw about $1.4 million in charges this year in terms of, through the, you know, through the beginning of April. And they had an average discount of 56% in network. So we were getting about 56% of, you know, discount on the total charges through the QualCare network.
Okay.
Which is, you know, it's right up there. It's pretty good discounts. And that's including physicians as well as hospitals. Hospitals tend to be a little higher and the physicians a little lower, so it balances out. But that's on the overall book of business.
Can you give us some comments, either qualitatively or quantitatively, regarding our employees' use of in-network as opposed to out-network services? I see you have sort of a chart attached, but I have a little trouble following it.
Rob, what page are you on?
Well, I'm not sure. I think at page 26, there's some kind of...
I think it's in the
8, the second 8, I believe it is.
Second.
Okay.
Roughly 86% of the claims were in network.
They were.
Is that a normal, or is that good, or is that compared to other places?
That's pretty standard. I mean, it's not far off the mark. I mean, in that 15% swing is good. I mean, you have the retirees and the Medicares and some of those that really don't, they're always going to be out of network in our eyes because they're not going to run through QualCare's network first, and about half our group are the retirees as well. So, but, this doesn't break it out for us that way. This is all employees. So I would say the 86% is pretty good.
If the plan design was such theoretically that it would work like a private industry plan where in-network and out-of-network would have different rates, co-pays, and deductibles, do you have some sense as to what that would do to the participation rate and the costs?
It's tough to say.
Okay.
Very difficult. That's a loaded question. I don't really know even how they would even underwrite the group, like Horizon would look at, your direct 10 access plan versus your program here, which is very passive. There's not a lot of, there's no in or out of network differential, basically, so there's really, it's very difficult to say. But I would say that most employees would try to stay within the framework of the network, because that's where their least out of pocket is,
So somebody going in network pays out less
Oh, absolutely.
than somebody going out of network.
Sure, because out of network, they can even get billed on your, there's UCR, which is usual, reasonable, customaries associated to the non-network claims, similar to a fee schedule in network. The doctor is expecting to get paid X. In an out-of-network situation, you're going to have your deductible coinsurance, plus you can balance bill over reasonable and customary. So that could really put a burden on an employee if they went out-of-network. They could have a big out-of-pocket compared to staying within the framework of the network.
It does happen,
It does happen.
and employees either change their doctor or agree to pay the increased cost.
Right.
So on this page 8 thing, right?
Yeah.
So under the PPO discount, so that by 86% of the claims or employees, retirees using in-network were able to take advantage of these PPO discounts?
Correct.
Okay.
And then we have a third party that we use that helps us negotiate out-of-network claims down as well. So we try to look at every claim and try to reduce the cost as much as possible.
Right, they're repriced as well.
Yes.
The
Oh, yeah.
out-of-network.
Yeah,
So
we'll look at
everything gets
those.
repriced, it's just
Right.
your network,
But you can
Gotta
still
be slightly
balance bill
better.
for it, even if we negotiate a discount down on the claim.
Are there any lasered employees this year?
This coming, yes, there is one person that is being lasered at a higher level than all the other employees because of his ongoing
Okay.
situation. And that's at $150,000, so.
One question I think that came up also last year was with whether it's a retiree or active employee, when they reach 62, they go on to Medicare, right? Is that?
65.
65, sorry.
Yeah, yeah.
Always screw that up. 62 is Social Security. So 65, that's the case, right?
Yes.
And how do we,
Well, as long
what's
as
the
they
process to
retire.
ensure that that happens among, like, in a given year? If there might be 2, 3, 4, whatever, people who hit 65.
Well, it depends. There's a couple scenarios. If they stay active, nothing happens within, because if you're active and you're 65, this plan is still the primary plan. Only when you retire that Medicare then kicks in and becomes the primary.
I don't believe that's correct.
That's not correct.
What,
We
for
changed
retirees?
that
No, it's not correct.
2 years ago, last
Yeah.
year, we changed that,
Yeah.
requiring it.
At 65, I believe that they go on to Medicare, they have to apply, and
For
then,
Part B,
we become the
Right.
secondary coverage.
Right.
if you're Medicare primary,
Correct.
Right.
correct, you would be the secondary payer to Medicare when
So
somebody's.
Medicare would cover it first, and then whatever's left over gets submitted
Correct,
to
the
you
20
to be
percentile.
paid.
Correct, the borough would be responsible for 20%.
Okay.
So how do we, what's our process, I mean, maybe it's not a question for you. How do we ensure that that happens? So
We
someone-
provide them the information on the ages every year.
You provide the information on what?
On the ages, every employee's age.
But is it happening, I guess, is kind of, because Mike seemed like,
Yeah, the eligibility is transferred back and forth from Evelyn, Becky sends it over to our...
administrative thing
So that-
happens.
I understand, but I
Of course
thought he
it
said
does,
it
yeah.
wasn't happening. That's
Okay, that was just my
No,
question.
Is it
you know,
happening?
I handle a ton of different municipal
I understand
entities, so my first inkling is that when you hit 65 and you're still active, the primary plan is still the borough in most instances. And now, if you have a provision there, then it's different. I don't recall.
Can we make sure that we are indeed making sure that's happening?
That was my
Yeah, we have the plan document. We can
But
just...
that was part of the changes we made to the healthcare, about a year,
Retiree, yeah.
retirees' healthcare about a
Yeah,
year and a half
I-
ago. It was part of,
I only recall one time that somebody was 65 did not apply, but that was maybe 8 years ago,
Okay.
If they didn't
that I know of.
Well, they missed the
They missed the
enrollment
enrollment.
time, so.
Right.
I guess the question is, can we make sure that those who are supposed to be doing that have done it, and that we are, that the records
Yeah, that it's-
accurately
Well,
reflect that?
So
So somebody at 65,
has to apply for Medicare Part B, is that what you're
Correct.
talking
Yeah.
about? Right, so
Medicare,
that's
but-
on the member's responsibility to handle that, right? That's
Yes,
not,
but we've only
that's not
had
a
one
function
that
of
has
Bill or
happened.
IDA
I
to
don't know the
handle
parts,
that.
but that's the.
The member would be.
Medical, yeah.
So I guess what my question is,
Part B is
what if they
supplemental.
choose not to do that, and they turn, like, that shouldn't
if they
be,
choose-
they need to do it.
They absolutely do need to.
Well,
So we need, someone, the borough needs to check or ensure.
I mean, the one case that we had, he was extremely upset because he wasn't, the plan wasn't covering his, at the full percent, so
right.
The, which plan?
our plan
Our
wasn't
plan.
covering.
Wasn't covering because he was
Because he
supposed to. Because he was
failed,
Oh, I see what you're
so
saying.
he was paying
Right, he would pay
out-of-pocket costs.
the
I see.
majority of the cost,
But
because
it
we would
wouldn't-
only pay 20% on
It wouldn't
that
be
part.
Part B, it would be
The regular
the
Medicare.
Medicare, the regular. Part B is supplemental, correct?
Well, you get, A is the hospitalization, and then
Right.
B is your major medical. if you
Oh, is that
will.
what it is?
Yeah.
And then there's GAP.
And you get the A automatically. You don't have to enroll.
So the A is what you get automatically.
A, you get automatically, and you build your credits, et cetera, through, to get.
So when that happens, are we no longer paying that portion of their health coverage? That's kind of, I think, the heart of the question here.
The, well, who pays what?
Medicare becomes primary under
becomes
our
primary.
plan.
So primary, it would go to Medicare. Are we sure that's
Correct.
happening?
Oh, yeah.
Yeah.
The borough sends you a letter a couple months in advance of your birthday to tell you, make sure you get your Medicare, and you have to go down to their office and sign up and all that.
Okay.
Okay.
No, no, as long as it's happening. I'm-
And I know they do it.
And I know that, I only know of one case where the person, for some reason, didn't do that, and then was paying out of pocket the difference
I see what you're saying.
from
Right.
what Medicare didn't, because he wasn't enrolled,
They weren't paying.
Right.
our plan was only paying the,
Right, so if you had a $100 charge, Borough's plan paid $20, let's say, and then he was responsible for the $80. So that was a wake-up call, and I remember that. But that was, a lot of times.
but it was quite a few years ago.
Yeah. But I think that was under our watch, if I recall.
Okay. Are there any other questions for Mr. Atkinson? Or Mr. Atkinson, do you have anything to add?
No, I mean, I think we have a very solid renewal. We did go to the marketplace. We went to 11 reinsurance carriers, and we got a flat renewal, basically. I mean, actually, it's a minus maybe 1% from last year's worst-case scenario. So, I mean, I think that our partner here did a very nice job in giving a very solid renewal to the borough, and, I'm very happy to continue our relationship. It's been a good one. I think it's worked. The plan definitely is more cost-effective, I would guarantee, than a fully insured program out there. You have the flexibilities. I know Bill's been doing a lot of negotiating with some units, and, that just wouldn't happen with Horizon. You'd have to go out and set up an HRA or do something, some other supplemental situation to pay those offset claims. But no, I think the plan's running well, and I think it's reflective in the renewal.
I have a couple of questions. This is looking down the road, but is our municipal health care plan subject to the analysis and penalties of Obamacare in 2018?
Some of them, yes. Not all of them, because you're self-insured. There's two taxes that you will not be subject to. It's at 2.3% of premium. If you're fully insured, you would have to pay the government. So in your case, let's say your plan's worth $2 million. 2 times 2.3%, you would have to pay the government. Plus, there's another, we call it like a belly button tax. Everybody gets a $1 tax one time. So, that's another couple $100 that you'd have to pay. But in self-funding, you don't have to pay that. Everybody has to pay the reinsurance tax, which I believe this year's around $67 per enrolled. And then another belly button tax, a $1 tax that you would have to pay this year coming up. But other than that, some of the other benefit provisions, if you will, have all been, age-dependent, age 26, some of the preventative care, things of that nature, wording, I believe it's waiting period and hours and things have been adjusted.
So you're saying basically the private industry taxes and costs that kick into 2018 are largely inapplicable to our plan here in the town?
Yeah, for the most part, yeah, unless something changes between now and then, yeah, half the taxes will be avoided.
Thank you.
How quickly can the preventative program that Dorothy was talking about, where they do the screening and keep the records, be implemented or initiated?
It doesn't take long. I mean, we could probably get it done and within the next 60 days if you guys are amicable to the pricing of it. I have to get the pricing of it, the number of employees you want to see. We also have a bus that we can bring by. We've done in some other municipals. It's cost about $5,000 a day.
Those are not actually, those programs are not in this proposal?
No, they're not. They're extra.
Well, you do have the
Well,
Affordable Care Act preventative.
Yeah, well,
yeah, right, you have the
everybody-
plan
You're talking
provisions,
about-
but
Everybody has that.
some of the other, the
It's me.
biometric screenings, if you want to do the blood draw and the whole
So those are
package, there is a cost to that.
A smoking cessation program would be extra as well?
I think we have some of that in our prescription plan now. I
Oh,
think
really?
that is covered. If somebody needed, they can go out and get the kits and do things on their own. But we could put one in. There are programs available that are inexpensive for that. It's just awareness more than anything else to the membership.
Have people been using the preventative and, is there a way for you to tell?
Yeah, I mean, if you look at the report that we were just looking at on page 8, there are codes there for well women, well care routine, et cetera. And yeah, people have been using it and going in network for those services. Again, we could do communication pieces to, encourage the usage or more usage of that because, obviously it makes sense to do, and if you catch something early, obviously it keeps our overall claim costs down. And
Now, this going for like an annual physical, is that coded as well care or well?
yeah, that could be under the well care routine exam. It really depends on the coding of the provider, but yes, that would typically be where that would fall.
Okay.
Now, is there something for the employees to alert them to this so that they make use of it?
Currently, right now, I don't believe we have anything set to notify the employees, every 6 months get your, exam, but that's something that we could definitely initiate and start
Well, so I think
to do a program.
If we're proactive in this and we tell the employees, go do the preventative stuff, in the long run, the cost
Sure.
will be less. So what I'm saying is maybe there should be something that's given out to the employees.
Well, all the new employees are given a copy of their plan that's
Okay.
applicable to them, and it's explained in there, what that entails.
And
But we're still working on, we have to update our books as of May 1st to add in the Affordable Care Act things and all of that. I mean,
Okay.
We've been trying to work with Mike and the other admin folks to bring that up to speed too, which is
Yeah,
not a
Tricia's
small
on that.
task.
No, it isn't.
And also, do you do any, I guess, health fairs or the vendors that we work with, say, for the dental and eye and prescription, whatever? My employer, we have like a fair where they all come down, they have little free giveaways, but they have information that they give out to people.
Sure.
Is that something we could do, and will that cost us anything?
No, we've done it in the past. There's no cost. I mean, it's just really, coordinating all the vendors and putting it together, setting up a day and getting it. I don't know if you've set up anything, Bill, but yeah, we could help you with that,
Right,
assist
so
you
if
with
that's something
that.
that would be free and give information to the people and kind of make it fun to learn about their benefits and why they should be having preventative and what they should be doing, and just make something, fun out of it and enjoyable.
Yeah, and one of the problems we have, and I think it's a good idea, but we're a small group, in the grand scheme of things, like where you are, it's pretty large, and then factor in that the largest portion of our, or close, the largest department, our police department, they're not all working 9
At
to
the same
5
time.
or every day of the week, so it does get difficult to schedule those, and you may only have a few people.
Well, if you include the active duty police and the retired police, that's 2/3 of your people.
Yeah,
And
exactly.
then you include some of the other groups we have, you may have a not-so-good turnout.
Yeah, and that's,
And
it's a good thought, but the challenges of it are exactly that
Right.
you're looking at 1/3 of the people at best, probably.
Any other questions or comments? Mike, I want to thank you for your
Nope.
time,
Thank you.
okay?
You don't have to worry. The good news is I'm not running, so I can't ask you the same question next year that I've asked you the last 5 years. probably. Maybe I'll come back as a
resident.
member of the public.
There you go.
Public
I'll
comment.
just play the tape from this year.
All right, thank you, guys.
I move for the introduction of the 2014 municipal
Well,
budget. Oh, sorry.
Okay, is this a separate resolution somewhere
Yes.
else?
Yeah,
Okay.
it's come to.
Okay.
Is it in the?
Yes.
It's on
Yeah.
the consent
Okay,
right.
agenda.
All righty.
It's on the consent agenda.
Okay.
Oh, okay.
Okay. Go ahead, Council
Okay, so I
President.
move the introduction of the 2014 municipal budget.
Is there a second?
Second,
I think Katie has a statement to read.
Be it resolved that the following statement of revenues and appropriations shall constitute the municipal budget for the year 2014. Be it further resolved that the said budget shall be published in the Home News Tribune in the issue of April 25th, 2014. The governing body of the Borough of Metuchen does hereby approve the following as the budget for the year 2014. General appropriations for, 1, appropriations within cap A, municipal purposes, $11,731,497.82. 2, appropriations excluded from caps A, municipal purposes, $3,496,940.56. Total general appropriations excluded from caps, $4,201,312.44. 3, reserve for uncollected taxes, $783,397.89. 4, total general appropriations, $16,011,836.27. 5, less anticipated revenue, $4,774,395.38. 6, difference amount to be raised by taxes for support of the municipal budget. A, local tax for municipal purposes, including reserve for uncollected taxes, $10,538,497.45. And C, minimum library tax is $689,943.44. Notice is hereby given that the budget and tax resolution was approved by the governing body of the Borough of Metuchen, County of Middlesex on April 21st, 2014. A hearing on the budget and tax resolution will be held at Borough Hall on May 19th, 2014 at 7:30 p.m., at which time and place objections to said budget and tax resolution for the year 2014 may be presented by taxpayers or other interested persons.
What is our procedure here, Katie? Do we have a vote now?
It's a roll call.
Yeah, okay,
It's a
roll call vote.
Your Honor, before we do that,
Yes.
I just ask, when we got here tonight, there was a large municipal data sheet on our desk. Our packet originally had a small one. Is there a difference in these two documents?
There were no changes according to the CFO.
Yeah,
and-
there are different notes in the larger, that weren't in the initial one.
Can you point them out before we, I mean, what do you mean? I'm not sure I follow.
Well,
Just so we all know what we're looking at.
okay. I believe the caps calculations were in the originals. However, sheet 3B, which includes the employee health benefit contributions, has been calculated and added.
Oh, so that was blank in the original copy we got?
That's correct.
Okay. Are there any other changes?
Yes, I believe so. Also, sheet 3E, which is analysis of compensated absence liability.
3E.
Can you explain what that means?
That is a number that is computed actuarially, I believe, that indicates what potential liabilities the borough would have in terms of any accrued sick or vacation time based upon collective bargaining agreements and other arrangements.
You
Which-
know what, I still don't understand it. What do you mean by compensated absences?
It's basically the value of unused sick time that our
So
employees
that's how
have.
much we owe?
It theoretically, if,
Theoretically, right.
Okay.
that's the value of all the
And I would
unused.
like to point out that that number is extremely low. If you read in the newspapers, sometimes you'll see individuals getting that total amount.
Yeah, no, that's not a bad number in the grand scheme, although it'd be great if it was lower.
Are those numbers all for just one individual in each of those line items, or for multiple? That's
Oh,
everybody?
no, that's for all of your employees.
Any other changes?
No, that should be it.
Thank you.
Okay. We had a motion, right, and a second, so we have a roll call?
Councilman Camerano.
Yes.
Councilman Grayzel.
Yes.
Councilwoman Insero.
Yes?
Councilwoman Rasmussen.
Yes.
Councilman Wallace.
Yes.
Council President Muldoon.
Yes.
Okay, I'm going to open it to the public now. For any questions or comments, please come forth to the mic and just state your name and address.
Good evening. I'm Sandra Flight, and I live at 194 Highland Avenue, and I am the president of the Friends of the Metuchen Library. We're concerned about the library budget, and I understand that you are only required to provide 1/3 mil per dollar valuation. The $699,000 which you spoke of represents a drop from last year, which represents a drop from the year before.
No,
I'm going to let our borough administrator answer that, ma'am.
no,
Yes, Sandra, you may not have been at the meeting when I explained
Well,
this, but Bill, why
let
don't
me
you
ask
go
the
ahead?
question. Were you going to keep us flat at last year's?
actually, your budget has been increased by $21 over last year.
Well, thank you very
Yeah.
much. I would like to
There
thank...
will be when they vote to do so.
Yes, yes. I would like to thank on behalf of the Friends, the council and mayor for raising that from the minimum payment to a stronger payment. It's not a lot of money, and it may not do the job forever to keep the budget flat, but I recognize that by stepping above the legal minimum, you're giving a vote of confidence to the library, which is a valuable resource which many of our residents use heavily. So thank you very much for maintaining the budget as is and preventing further loss.
Sandra, if I may, just to give you an idea how it happened, I mean, you've been at the meetings. I don't know, somehow we must have crossed on that one.
I think the number mentioned was the number taxed rather than the number granted, so I
That-
wasn't
that could
sure
be.
that that had gone through.
But shortly after we saw what the figure was and the drop for this year, met with the mayor, who then met with the library, the new library director, as well as the interim library director, with members of the finance committee early one morning. It was all presented to him, And as a result of that, we've all agreed that we need to fund it at the current level.
That's
So
great.
We understand your value, believe me.
Yes. Thank you very much.
You're welcome. Anyone else from the public? Ms. Bransfield, you're not going to come up and say anything? Oh, okay. I know. Anyone else? Hearing none, I'll close that section of the meeting. We have a proclamation that Mrs. Rasmussen is going to read.
Yes.
You have somebody from your committee here? No?
No, only because I'm going to reread this again at the actual Arbor
Okay.
Day, so I'll just kind of read it here so the public sees it, and then I
Okay.
will invite them to come to Arbor Day on Friday. Okay, Arbor Day proclamation. Whereas, in 1872, J. Sterling Morton proposed to the Nebraska Board of Agriculture that a special day be set aside for the planting of trees. And whereas, the borough will hold their National Arbor Day observance on April 25th, 2014, and is the 142nd anniversary of the holiday. Whereas National Arbor Day is now observed throughout the nation and the world, and whereas the benefit of trees as part of a stable global environment are well recognized, and whereas the special importance of trees in urban areas in reducing energy use and maintaining an awareness of the natural world is also evident, and whereas the Borough of Metuchen is committed to preserving and renewing its numerous and beautiful trees, which enhance the quality of life in our community. Now therefore, I, Thomas Vahala, Mayor of the Borough of Metuchen, County of Middlesex, State of New Jersey, do proclaim April 25th, 2014 as the official celebration of Arbor Day in the Borough of Metuchen, and urge all the people of Metuchen to celebrate Arbor Day and to support efforts to protect our trees and woodlands. Further, I urge all citizens to plant trees as a source of joy and spiritual renewal, and to promote the well-being of this and future generations. Dated April 21st, 2014. And I would like to say, I would like to invite all the residents of Metuchen who are available on Friday. We are actually having the Arbor Day celebration at the old schoolhouse, where we will be planting several small trees that'll take a long time to grow, but we are always planting for the future. Trees that we plant now will not really have its full effect for maybe 20, 30 years. So that's why we can't stop our planting of trees or slow down our planting of trees, because it takes a long time for them to grow to their full potential. We'll be having, cookies, juice, coffee. Please come down, old and young alike. We welcome everyone, 3:30 at the old schoolhouse, rain or shine. Thank you.
Thank you very much. We now have a couple ordinances to consider.
Yes, we have ordinance number 2014-2. Katie, would you read present an affidavit of publication?
Said ordinance has been published one time in the Home News Tribune according to law on April 11th, 2014.
I move that the affidavit be received and filed.
Is there a second?
Second.
All in favor?
Aye.
Aye.
Okay, would you read the ordinance by title?
Ordinance 2014-2, an ordinance to authorize acceptance of deed from the District at Metuchen LLC for Block 35, portion of Lot 5, for use as public right-of-way.
We're now going to hold a public hearing on this ordinance, and this ordinance only. This is a small portion of the road that, for many years, people would say to me, why can't we do something with the potholes? That is the area behind Blockbuster, which, if you notice, it is paved now. It has been purchased by Metuchen LLC, and they are donating this, deeding it to the borough. So it'll be an access road from that property. Anyone from the public have any questions or comments?
Actually, it was a condition, I believe, of their approval.
Correct.
Yeah,
Correct. Yes. Hearing none, I'm going to close that section of the meeting.
Okay, move that ordinance 2014-2 be passed on second reading and published according to law.
Is there a second?
Second.
It's a roll call vote.
Councilman Camerano?
Yes.
Councilman Grayzel?
Yes.
Councilwoman Insero?
Yes.
Councilwoman Rasmussen?
Yes.
Councilman Wallace?
Yes.
Council President Muldoon?
Yes.
Okay, the ordinance carries.
Now we have ordinance 2014-4. Katie, would you present an affidavit of publication?
Said ordinance has been published one time in the Home News Tribune according to law on April 11th, 2014.
I move that affidavit be received and filed.
Is there a second?
Second.
All in favor?
Aye.
Katie, would you read the ordinance by title?
Ordinance 2014-4, calendar year 2014, ordinance to exceed the municipal budget appropriation limits and to establish a cap bank.
Okay, before I hold the public hearing, Bill, could you give us a little synopsis of what this does?
I will try. Under the 1977 appropriations cap law, which I'm sure you all remember well, any municipality was allowed to increase appropriations based upon a price inflator, and not above that unless they passed an ordinance to exceed the appropriation limit. This year, the cost of living adjustment is 0.5%. The law allows us to go up with the ordinance to 3.5%. This allows for an additional $341,486.64 to be used for appropriations. It does not mean that the borough is going to appropriate that much money. It allows the municipality to go up that amount. And if the municipality does not do so, it also provides for a bank which can be used in future years should the municipality need to do so.
Okay. I'm going to open it to the public on this ordinance and this ordinance only. Hearing no questions or comments, I'm going to close the section of the meeting.
I move that ordinance 2014-4 be passed on second reading and published according to law.
Is there a second?
Second.
It's a roll call vote.
Councilman Camerano?
Yes.
Councilman Grayzel?
Yes.
Councilwoman Insero?
Yes.
Councilwoman Rasmussen?
Yes.
Councilman Wallace?
Yes.
Council President Muldoon?
Yes.
Okay, so the ordinance carries. Council President?
I move that communications consent agenda items A and B be approved.
Is there a second?
Second.
All in favor?
Aye.
Okay. We're at that point where we have reports of the council members. Council President?
Thank you, Mayor. A little update, as mentioned earlier in the meeting, that the mayor, borough administrator, and I met with the police chief and police captain this morning, as we do just about monthly. And we discussed some of the pedestrian safety efforts underway and being planned. And I think at the last council meeting, there was a request for some reporting from the police department on their enforcement activities. So since January 1st, the police department has spent a little over 94 hours doing pedestrian safety specific enforcement in the borough. They've issued 74 motor vehicle summonses for things like failure to yield to pedestrians in a crosswalk and other automobile safety violations. As has been noted by many residents in the past few weeks, there's been increased police officer visibility in the downtown area, and I think that will be increasing because the chief told us that starting on May 1st, the police bike patrol is going to be reactivated. So each day, there'll be at least one police officer on bike patrol, not just in the downtown, but other areas of the borough. So that, again, is going to be increasing the visibility throughout the borough. The police captain is working with Freeholder Polis on an initiative that we discussed with him, I guess, a couple months ago when we met with him also, And that is this coordinated pedestrian safety sting that's going to be conducted on Route 27 at some time, maybe in May, I don't know the exact date, but it's a coordinated sting in Edison, Metuchen, Highland Park, New Brunswick, and possibly Woodbridge, which is a great idea because it's going to, again, signal to drivers that are coming in, not into Metuchen and going through Metuchen, the importance of observing our pedestrian safety ordinances and regulations. And then the other thing is Metuchen senior citizens, the police department, and representatives of the New Jersey Department of Transportation will be conducting a senior walkability workshop that will take place on June 4th at the Metuchen Senior Center. This is a new program that's funded by the DOT that we have the opportunity to take advantage of. I think we learned of it through Karen Alexander, who's on the Traffic and Transportation Committee, contacted Sergeant Flaherty, who's been doing a lot of the pedestrian safety talks, and then brought it to the attention of our group this morning, and we agreed to have this. And the senior walkability workshop is meant to attract senior citizens as well as community decision makers. So people from the borough, public works, engineering, mayor, hopefully some council folks, borough administrator, DPW, everyone who's involved in operations, transportation, roads in our community. And the workshop, it's from from 9:30 to 12 o'clock, but it's to really help us better understand the needs, the mobility needs of seniors, learn about some of the best practices in a walkable community design, and then learn how we can address the challenges that they have. So we're going to be doing a lot of publicity. Kathy Ostermeller from the Senior Center is involved, and we'll be reaching out. But it's a great, to Councilwoman's question earlier this evening about reporting on complete streets. These kind of programs are things that communities who are committed to complete streets will do things like this, because when we talked about complete streets, seniors is one of the targeted groups that we need to kind of be more aware of. So there'll be more information, but this all came together. The date was selected today. So it's going to be Wednesday, June 4th, 9:30 a.m. till 12 at the Senior Citizen Center. And I want to thank Artie and Flaherty and Karen Alexander for making us aware of this cost. It's no cost to the borough, so I think it's a good program. And I think that's all I have. Yes.
Okay, thank you. Councilman Wallace?
Thank you, Mayor. And just a quick comment to Council President Muldoon. I have personally seen the police crossing, checking these police crossings. They had the Main and Woodbridge one staked out this morning.
Oh, this morning, yeah?
I did see him there, and I've seen him at Middlesex and Center several times, and also Main and Woodbridge other times. I commented to him at the last Traffic and Transportation meeting. All right, at Recreation, the daddy-daughter dance was a couple weeks ago, and it went over. You couldn't imagine the excitement of it. The little girls with their fathers, and I think everybody but one Recreation Commission member was there participating and helping out in that project, and that is an overwhelming thing for the town, and it's loved by everybody. The Easter egg hunt was last Saturday. I was there. The mayor also stopped by to see the Easter Bunny. The fire department delivered the Easter Bunny. It was very heavily participated in, and again, I can't compliment these people enough, every single member of the Recreation Commission was there participating and helping out. Every single one of them. They're printing a book on all programs that are going to be coming up during the summer and the fall. Should be ready in another week or so, and it'll be distributed out to everybody. Under Traffic and Transportation, We had a meeting last week. We had some good comments from the Sergeant Flaherty, who I think is doing a fantastic job. Any little training or anything out there, he's going to it. He's putting a lot of time into it. We spoke on the flag situation, how things are going, about the repair of the lights that they know are coming up, and just some other general subjects to keep up with things and be ready with some other things.
And that-
That's all that's my report, Mayor.
Thank you. Councilwoman Rasmussen?
Okay, the Shade Tree Commission had their tree giveaway prior to the Sandy recovery, and it was a great success. We had a joint effort combining resources of the Shade Tree Commission, the Environmental Commission, and also a member from the Garden Club. And this kind of working together is something I'd like to continue into the future. And of course, we had our mayor there assisting for a couple of hours in the giveaway, and he had an experience there that I think we'll talk about in a few minutes. We still have some trees available, so if you're interested in Douglas fir, silky dogwood, willow oak, or northern red oak, email me at drasmussen@metuchen.com, and I'll see that I can get some to you. The spring planting will commence approximately May 7th, weather dependent, and we will be planting homeowner requests and tree of life requests only. We will be planting approximately 11 trees. Also, the Shade Tree Commission received notification of a grant award from the New Jersey Department of Environmental Protection Green Communities Grant for $3,000 to hire a consultant to assist in updating the community forestry management plan. And that plan is an essential guide to successfully achieving a healthy, economically efficient, and safe community forest. The plan may lead to increased community safety, lower tree hazard problems, decreased tree maintenance and removal costs, less emergency tree calls, increased tree benefits, and reduced municipal cost that is not just tree-related, and develop a proactive, not reactive approach to tree and forest management. It also helps communities prioritize limited financial resources to optimize goals, objectives, and results. And once again, I will say that Arbor Day celebration is Friday, April 25th at the Old Franklin Schoolhouse at 3:30. We will be planting some seedlings, reading the proclamation, and having refreshments. The Environmental Commission watched a video on how to create a rain garden that will guide us when we commence our project at Edgar School to assist in an erosion problem near the Edgar Woods. We are still waiting to hear if we were awarded a grant for $1,500 we applied for through ANJAC to purchase supplies needed to bring this project to reality. And also, we discussed Earth Day, and we were discussing having an electronics recycling week where we would focus people on specifically recycling electronics to DPW, and the Environmental Commission would assist as needed. And I just wanted to give like a little distribution analysis of our trees. The silky dogwoods, we distributed 129 out of 173 trees. The northern red oaks, we distributed 50 out of 97. The Douglas firs, we distributed 74 out of 115. And the willow oaks, we distributed 35 out of 96. And that's my report.
Thank you very much. I'll comment later in my
Of course.
report. Councilwoman Insero.
Thank you, Mayor. I'd just like to remind everyone that this Friday at 7 p.m. at Campbell School, the Metuchen Municipal Alliance is having a magic show to raise money for the Youth Services Board, which aims to seek reduce drug prevention in the community. I'm sorry, I'm skipping over my words tonight. Tickets are $10 for each adult, and each admission also includes an entry for one child, and each other child is $3. They're also funding a special speaker at the high school in June for juniors and seniors. This is not a public event, but I just want to mention that as another program that they're doing to encourage youth at the high school to be drug-free. The Board of Health is meeting this Wednesday at 7:30 p.m., and the Senior Citizens Commission is not meeting again until June. If there are any citizens out there who are looking to get involved and are interested in helping the senior citizens with some special projects later in the year, consider contacting me, and that's all I'll say about that. Thank you.
Okay, thank you very much. Councilman Griselle?
Thank you, Mayor. I'm happy to announce that tomorrow night will be the first meeting of the Accessibility Council. I'll report on that meeting at our next Borough Council meeting.
Hey,
There
Ron,
is-
Ron, sorry to interrupt, but just, I thought, it might be great to have someone from that accessibility committee attend the senior walkability workshop I mentioned, because parts of that community may have the same challenges about mobility, so.
I'll bring that up.
Well, okay, thank you.
Presently in the Rotunda Gallery is the work of Monroe artist Thelma Freed. She works in oils, watercolor, pen and ink. Please stop by and see the show. This Sunday, April 27th, from 12 to 2, will be a gallery opening, and the public is invited. Given the recent success of our community art projects, the Art Council, in conjunction with the gallery chairs, is sponsoring a program called Sheep on Show. And basically what that means is that there are going to be created some wooden sheep. And the wooden sheep are going to be available for purchase at $20 per sheep. And there will be art supplies provided, and you can paint and decorate them any way you'd like. And then you can have them graze right on your front lawn, or maybe if you really like some prominent place, you can have them graze on Pete Camerano's front lawn.
You're welcome, because nobody wants to see my artwork.
The program is on May 18th over at the Old Franklin Schoolhouse between 1 and 5. It'll be a lot of fun. This actually was a seed planted by Sherry Rose Rubin when she came to the Arts Council when she still was a councilwoman. And she said there were similar art projects where she would go on summer vacation. And it's really a wonderful explosion of community art. So again, it's May 18th, 1 to 5 p.m. If you'd like to reserve your sheep, you can email info@boroughimprovementleague.org, or you can call 862-368-2202. We're looking forward to a great turnout.
Can you repeat that phone number, please?
Yeah, the phone number is 862-368-2202, or info@boroughimprovementleague.org. The Cable Technology Advisory Committee is going to meet again this Thursday to discuss its negotiations with the cable provider. That completes my report, Mayor.
Thank you. Councilman Camerano?
Councilman, I just have one question on the sheet. Is it permitted to recruit a ringer artist so you look like you know what you're doing?
Yeah,
And
absolutely.
do the financing of it and put it on my lawn, and, you know,
Yeah.
people think I have talent?
They will.
All right, I'm going to find somebody to do it. Your Honor, I don't have much to report. We had two individuals here tonight from the Friends of the Library, and I'm sorry they left because I think many times they go unrecognized for the contribution they made. In recent years, when the library fell on hard budget times, decreasing funding, it was the Friends of the Library kind of picked it up and allowed, through their generous donations, projects to move forward. So, you know, I wish they were here. They deserve tremendous recognition. The Friends do a great job, and they have done for many, many, many years. And their interest seems to be growing as opposed to many groups where it's starting to dwindle. I have no further report. All my groups have met or will meet later in the month.
Okay, thank you very much. Dennis, do you have a report?
No, I have nothing to report, Mayor.
Bill, do you have a report?
I do, Mayor, very briefly. Work started today on the Jersey Avenue pump station improvements. It is anticipated that they should be largely completed by the end of the week.
Okay, I have a couple brief things. One, there was a great response today by our fire department over at the Metuchen Food on Central Avenue. Evidently, someone was doing some roof work and started up, the roof started on fire and got into the insulation, but the response was really good. And if that had spread through the ceiling rafters, it would have been a real disaster, but because of our fast response, it was taken care of quickly. The other thing is that the fire truck will be in on Friday. I'm not sure what time that's being planned on Friday evening.
It might be next week.
No, I think it's Friday. I got a thing from the chief saying it's Friday, but I don't know what time.
Well, we're going to try to do it Wednesday night, and then they're getting a few things
Okay.
mounted and stuff, and I don't know whether it'll all be done by Friday.
Well, he told me today that, he texted me.
Okay.
Councilman Wallace as far as fire department.
Okay.
No offense.
So the new pumper will be in. Ironically, I was out to dinner the other day and at Applebee's, and the waiter there was telling me how during the school fire he was very, very impressed, because he lives right near the James Monroe School, with the response from our fire department. Our hook and ladder was there, I think, till 6 or so in the morning, 7 in the morning. We also covered one of Edison's houses, and had to respond to another fire. But he said they were really, really impressive in the way, and professional in the way that our fire department handled that. And then, ironically, today I was at that other fire, and I heard the same thing from the JFK EMS people. The other thing you should be aware is that JFK is now opening its new emergency center. I was there the other day with our OEM director, and it is an amazing center. It's really top-rated, top-notch, and not that I want anybody to have to go over to the emergency room, but it is a top-notch facility. And the last thing was, I enjoyed myself Saturday with all of the groups handing out trees. I was amazed to see a steady flow of people coming in, giving out the trees, and as you said, we gave out 288 trees in that time. And we know we have some more to give out. And if we have some left over, what I'm looking at doing in possibility, but I know that Dorothy has to talk to the Shade Tree Commission, is to find an area where we could plant some of these trees and then maybe harvest them later so that we could use them as they get bigger. Because we had been told they'd be 4 feet, 3 feet tall. Some of them are like 6 inches or a foot tall. Yeah. So we're planting ours into planters, and then we'll retransplant them after they get to be a little bit hardier. But I think it's a really progressive, positive day. We had a lot of people coming in, looking at the various trees and taking the trees, and I think it was a good feeling and a good day for the borough. And that concludes my report.
I move that new business consent agenda items A through G be accepted.
Is there a second?
Second.
All in favor?
Aye.
Okay.
I move bill resolution in the amount of $308,329. Sorry, $308,329.64.
Is there a second?
Second.
All in favor?
Aye.
Okay. Now going to open to the public for any questions or comments. Hearing none, I'm going to close that section of the meeting.
I move for adjournment.
Is there a second?
Second.
Second.
All in favor?
Aye.
Thank you very much for a very good meeting.